Did you know that Parkinson's Awareness Month is April and that the red tulip is the Parkinson's symbol that shows support for people living with Parkinson's and their families globally? Although Parkinson's Awareness Month is April, I feel there's a need for awareness now. Recently, Congress has passed the first ever federal bill dedicated to ending Parkinson's. While this is great news and one step closer to ending Parkinson's disease, there is still a need to keep moving forward in finding a cure and to keep creating an awareness of how Parkinson's affects a person and their families. When a person hears of someone who has Parkinson's, one of the first things they think of is tremors, mostly in the hands. What they don't know is tremors can affect other parts of the body as well. As a matter of fact, there are several other symptoms that people are not aware of. I call this the iceberg effect. The part of the iceberg that shows on top of the water are the symptoms that people are generally aware of, like the tremors. The part of the iceberg under the water is the symptoms that people are not aware of. While there are many symptoms of Parkinson's disease, I'm going to show you 10 symptoms that most people are not aware of. Number 1, digestive issues. Constipation is just one of the digestive issues that Parkinson's can cause. There is also diarrhea, excessive saliva, and bloating, to name a few. Number 2, speech. Parkinson's can weaken the vocal cords. This can cause a softening of the voice. Stuttering and spasms within the voice box are also Parkinson's speech symptoms. Number 3, excessive fatigue. Fatigue caused from Parkinson's is a non-motor symptom. The cause from fatigue is unknown. Number 4, mental health. Parkinson's can lead to a variety of concerning emotions, including anxiety and depression. Low dopamine levels are linked to these conditions. Your medication and exercise can help with relieving these symptoms. Number 5, hypomimia. Hypomimia can be a symptom of Parkinson's. It is also known as facial masking that reduces facial expression. Number 6, cognitive changes. These cognitive changes are another non-motor symptom that may cause memory loss, affect language, and attention span. Number 7, sleep disorders. This symptom can cause restless sleep and insomnia. Number 8, change in gait and posture. Although a motor skill, stoop posture and shuffling of feet are symptoms people generally do not associate with Parkinson's disease. Number 9, handwriting. The handwriting with someone who has Parkinson's sometimes tends to be small. The handwriting change can be due to slower movement and possibly the hand that is affected by a tremor. Number 10, last but certainly not least, is the loss of smell. This is a symptom that people with Parkinson's sometimes experience long before they are diagnosed. It is a non-motor symptom that people generally do not associate with Parkinson's disease. While taking the right medication is extremely important for managing some of the symptoms of Parkinson's, one should not rely strictly on medications for relieving symptoms. Good nutrition is crucial for managing Parkinson's symptoms. Focus on whole foods like vegetables, fruits, lean meats, and whole grains. Cut back on sugar and processed foods to support overall health and well-being. One of the first things doctors usually recommend for newly diagnosed patients is exercise to help fight back and manage symptoms. Exercise is extremely important because it helps to slow down the progression of symptoms and create an overall feeling of well-being. I hope this video has showed the value in being aware of the many symptoms of Parkinson's. If you or someone you know has Parkinson's, check out Parkinson's Exercise Corner. Control your Parkinson's through exercise. There's hope through exercise.